Hello and welcome to our channel. Today we're discussing the use of low-dose Rivaroxaban for preventing thromboembolism in high-risk ambulatory cancer patients. Let's dive into the key findings from the Cassini trial. Patients with active cancer are at an increased risk of venous thromboembolism, or VTEL. Small trials have suggested benefits of using low molecular weight heparin, or LMWH, products for VTEL prevention, but their injectable form limits widespread use. Risk stratification tools like the Corona score now help identify high-risk patients. Direct-acting oral anticoagulants, or DOACs, have shown efficacy in VTEL treatment in cancer patients, but their role in VTEL prevention needed further investigation. The Cassini trial aimed to address this. It was a multi-center, randomized, parallel group Phase 3b trial. The study included 841 cancer patients at high risk for VTEL, identified by a Corona score of 2 or higher. Patients were randomized to receive either low-dose Rivaroxaban, 10 milligrams daily, or a placebo. The duration of follow-up was 180 days, and the primary outcome measured was the incidence of venous thromboembolism. Who were the patients included in this trial? They were ambulatory outpatients aged 18 or older with solid tumors or lymphoma. All had a Corona score of 2 or higher and an expected survival of more than 6 months. Additionally, they were starting a new systemic regimen within a week of initiating the trial regimen. Patients were randomized into 2 groups, one receiving Rivaroxaban 10 milligrams daily and the other receiving a placebo. Enrolled patients underwent venous duplex compression ultrasonography to rule out pre-existing deep vein thrombosis, or DVT. Follow-up included trial visits at week 8, week 16, and day 180, with screening compression ultrasonography at each visit. Let's talk outcomes. The primary outcome was the incidence of venous thromboembolism at 180 days. VTEL occurred in 6.0% of patients receiving Rivaroxaban compared to 8.0% with placebo, yielding a hazard ratio of 0.66. However, this result was not statistically significant, with a p-value of 0.10. During the intervention period, a 3.6% absolute reduction in VTEL with Rivaroxaban was observed. Major bleeding occurred in 2.0% of patients on Rivaroxaban versus 1.0% on placebo. Every study has its criticisms. The VTEL benefit with Rivaroxaban was only seen during the intervention period, which is subject to bias. High rates of premature study drug discontinuation at 47% also biased the results towards a null effect. As of March 2019, no guidelines have been published that reflect the results of this trial. The Cassini trial was co-sponsored by Janssen and Bayer, who were involved in data collection and analysis. For those interested in diving deeper, here are some further readings and references. Agnelli G. et al. Nadroparin for the prevention of thromboembolic events in ambulatory patients with metastatic or locally advanced solid cancer receiving chemotherapy. Lancet Oncol. On 2009. Agnelli G. et al. Semuloparin for thromboprophylaxis in patients receiving chemotherapy for cancer. N. Engel. J. Med 2012. Corona AA et al. Development and validation of a predictive model for chemotherapy-associated thrombosis. Blood 2008. Thank you for joining us today. If you found this video helpful, please like, share, and subscribe for more content on medical research and clinical guidelines. Until next time, stay informed and take care.